From the JAMA Network, this is JAMA Clinical Reviews, interviews and ideas about innovations in medicine, science, and clinical practice.
Hello, and welcome to this JAMA podcast. I'm Dr. Kirsten Bibbins-Domingo, Editor-in-Chief of JAMA and the JAMA Network. I'm joined today by Dr. Katrina Donahue, a family physician and professor and vice chair of research at the University of North Carolina at Chapel Hill, Department of Family Medicine. At UNC, Dr. Donahue is also a senior research fellow at the Cecil G. Sheps Center for Health Services Research. She co-directs the North Carolina Network Consortium, a meta-network of 6 practice-based research networks and 4 academic institutions in North Carolina. Dr. Donahue is also a member of the U.S. Preventive Services Task Force and is joining us today to discuss the new recommendation statement from the task force on folic acid supplementation to prevent neural tube defects. JAMA is publishing this recommendation statement and the evidence report on which the task force recommendation statement is based. Dr. Donahue, thank you for joining me again to discuss the work of the task force.
Oh, thanks for having me here today to talk about folic acid supplementation for the prevention of neural tube defects.
Wonderful. So I always like to start by giving you the chance to tell me at the highest level, what's the summary, what's the key take-home message? What should we know about folic acid supplementation?
Yes, folic acid supplementation can prevent neural tube defects. And neural tube defects are one of the most common congenital malformations in the United States. So the U.S. Preventive Services Task Force reviewed the evidence and recommends folic acid supplements before and during early pregnancy to help prevent neural tube defects. This is an A recommendation.
An A recommendation is one of those very strong recommendations. It means you have evidence and the evidence of benefit is clear and that the benefits far outweigh the risk and you have a high level of certainty about that. Would that be right?
That is true. This is a simple and easy intervention.
So, Dr. Donahue, this sounds like this recommendation statement really applies broadly to anyone planning to become pregnant or who can become pregnant. Are there groups to whom this recommendation doesn't apply?
Yes, this recommendation does not apply to persons with a previous pregnancy affected by neural tube defects or at very high risk, such as persons taking anti-seizure medications or have a family history of neural tube defects. There are different guidelines for these groups.
So these are groups that are at particular high risk for neural tube defects, and so separate guidelines apply to them.
Correct.
Tell us about the intervention. So we're talking about people who can become pregnant or who are intending to become pregnant. Tell me about exactly the timing of folic acid supplementation.
Yes, all pregnancies are at risk. So anyone planning to or who could become pregnant should take folic acid. And the timing is important. The best time to take folic acid supplementation is 1 month prior to pregnancy up to the first 2 to 3 months of pregnancy.
Okay, so this is an A recommendation, and this is a recommendation that's been on the books for a while, and the benefits are clear. So why is the task force still weighing in on this topic? We've known this for a while. How common is it that people are taking supplements?
Folic acid, it's a form of folate, which is a vitamin found in fruits and vegetables and other food. And many people don't get enough folic acid in their diets. And only 20 to 40% of persons trying to get pregnant or are recently pregnant report taking folic acid. So we feel this is an important place and room for improvement here.
I see. So there are 2 things that I heard you say there. So even though it occurs in the diet, and I know that the U.S. diet is actually fortified, many products in the U.S. diet are fortified with folic acid, that despite that, it is the case that people oftentimes don't have enough folic acid in their diet when they're becoming pregnant. And what you're also telling me is that only about 20 to 40% of people who are pregnant or intending to become pregnant in some surveys the task force reviewed actually are taking supplements.
That's correct.
So sometimes the task force, and it sounds like in this case, is really making a recommendation statement, not because we believe there's new evidence to say we shouldn't do this, but because we really want to reinforce the importance of this type of action, in this case, a preventive medication that really can change an important health outcome, in this case, preventing neural tube defects.
That's correct. The task force statement, it's a reaffirmation of our 2017 recommendation on this topic and is consistent with our 2017 recommendation. We recommend that all persons planning to become pregnant or who could become pregnant take a daily supplement containing 400 to 800 micrograms of folic acid.
Was there new evidence that the task force reviewed for this statement?
Well, there were 3 observational studies since the last recommendation, and there was one large Norwegian cohort study that noted that in periods of greater folic acid supplementation adherence, that there was a statistically significant reduction in neural tube defects. So, in essence, the evidence since 2017 reaffirms our recommendation that folic acid supplementation is important.
Important that the new evidence reaffirms this. Is this something that everyone who can become pregnant needs to pay attention to, or are there groups that are at higher risk for a pregnancy to end with a neural tube defect?
So, all pregnancies are at risk. So, anyone planning or who could become pregnant should take folic acid. There are risk factors for neural tube defects in addition to this, such as medications that impair folic acid metabolism, family history or genetic risk factors, or malabsorption due to weight loss surgery. Additionally, ethnicity is also a risk factor. Hispanic persons are at higher risk for neural tube defects.
So, do we know why there are higher rates in Latina individuals?
We don't, and we're calling for more research on the effectiveness of folic acid supplementation in reducing neural tube defects in Hispanic people. Hispanic people are at higher risk for developing neural tube defects. In addition, we are interested in factors that contribute to the differences in amount of folic acid that people take.
So it sounds like we don't know much about the cause for why there are actually higher rates in Latina individuals. And so one of the things the task force is doing is to call for more research in that area. You also said you are interested in research on the exact level of supplementation. Can you talk a little bit more about that?
Sure. As you mentioned earlier, given the fortification of food in the U.S., are there other groups that should be identified as high risk? We've enriched cereal grain products since 1998, and there's been voluntary fortification of corn masa starting in 2016. So we're interested in learning about the factors that could contribute to these differences in the amount to folic acid that people take.
So you're a family physician. With whom are you having a conversation about folic acid supplementation?
Well, half of all pregnancies are unplanned, so it's really important to recommend that all people who are planning to become pregnant or who could become pregnant take a folic acid supplement daily.
So you're having this conversation with then most of your patients who can become pregnant, given that a large fraction of pregnancies are unintended, unplanned.
That's correct.
So in what form are these supplements generally that people take? Do they take them as a part of a daily vitamin that has other things in them? Do they take them by themselves? What's the form?
Supplement can be taken as a folic acid supplement by itself or can be found in the form of a prenatal vitamin or multivitamin.
And is there any harm? Is there any worry that because I'm eating lots of fruits and vegetables and I also take a supplement, is there any risk that I could be taking too much?
Well, we looked at the evidence of potential harms for folic acid supplementation at recommended doses, and we did not find any increased harm with regular dosage of folic acid supplementation.
So really the take-home message is that if you are intending to become pregnant or you can become pregnant, that you should be taking a folic acid supplement.
That's correct.
Okay, so once again, what's the final take-home? What do you want our listeners to know?
Well, this is an important topic, and it's a simple intervention to prevent neural tube defects. Neural tube defects cause serious complications for babies, including disability and death. But fortunately, taking folic acid before and during early pregnancy can help prevent neural tube defects.
Okay, this is an important reaffirmation statement from the U.S. Preventive Services Task Force. I've been speaking to Dr. Katrina Donahue, who's a family physician and a member of the U.S. Preventive Services Task Force, about the new task force recommendation on folic acid supplementation to prevent neural tube defects. This is an A recommendation, a strong recommendation in favor of this supplementation. And this episode was produced by Daniel Morrow at JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thank you to Dr. Donahue, and thanks for listening.